Hello, this is Dr. Janisch. Now we're going to demonstrate a platelet-rich plasma injection for tennis elbow. A PRP injection starts off with a blood draw. This particular patient had very difficult veins, and in situations like this I like to take the time to look around, find a good vein, and mark it with a skin marker. A platelet-rich plasma injection is a wonderful way to treat tennis elbow, and it's being shown through new studies that are coming out currently that it is actually superior in treating tennis elbow when compared to corticosteroid or cortisone injections. Now I clean the arm with chlorhexidine and the blood draw begins. For tennis elbow I usually draw 40 cc's of whole blood. That's mixed with 5 cc's of anticoagulant that was already in the syringe when we started. This gives a total of 45 cc's of volume in the syringe. As soon as the blood draw is complete, pressure is applied to the draw site, and the syringe is gently mixed to prevent the platelets from activating. The syringe is then put into the separating machine, which is a Magellan. We've done quite a bit of research and found this to be the best system on the market. As soon as the large syringe is hooked into the machine, we'll check the settings, and I've asked the machine to condense 4 milliliters of platelet-rich plasma from the original 45 milliliters of whole blood mixture. You'll notice that the large syringe on the right is now emptying its contents into the machine, which is spinning actually much faster than it appears on the video. This goes through several different stages and actually speeds up quite a bit. You'll also notice some red lasers back behind the part that's spinning, and that's what's actually checking the separation. Once the machine is spun for about 15 minutes, it empties its contents back into the 2 syringes. The syringe on the right has the discarded blood, and the syringe on the left is the platelet-rich plasma. Here in the video it looks dark like the blood does, but I'll hold it in front of my glove to give you a better view. It's actually quite light. While the blood is spinning and being prepared, I actually take the time to mark the patient's arm at their point of maximal tenderness. And we'll later confirm that this spot is over the known injury in the common extensor origin, which is where the tennis elbow is taking place. I'll then clean the arm with chlorhexidine swabs. Now we're going to put in some numbing medication to ease the discomfort of the coming injection. The injection that I'm doing now is strictly 1% lidocaine without epinephrine. I've asked my nurse to spray some cold numbing spray on the skin prior to the injection, which helps the initial bite. The lidocaine is then spread out into the arm, creating what I call a fan-type block. Now we're going to set up the sterile ultrasound. This is a long plastic bag, and the nurse has to squirt some ultrasound gel into the bottom of that so that there's no air between the ultrasound probe and the bag itself. Place a few rubber bands on the end of that to hold everything in place and smooth out any air bubbles. Now it's time to go get the platelet-rich plasma. You can see that it is much lighter than whole blood. This is a very nice sample. Some sterile ultrasound jelly is then placed over the injection site. And we make sure our ultrasound is fine-tuned and ready to go. Now I'd like to point out a few anatomical landmarks on the ultrasound screen. This area that I'm showing, the dark area, is the actual known tear in the common extensor origin. The bright white band is the bone, and that's actually the lateral epicondyle. Above it is the tendon that looks like a river. This is the radial head and the joint between the proximal radius and the humerus. The needle's then placed under the skin, and I'll follow that down on ultrasound right into the area of injury. You can see my needle is now entering right into the area of injury in the common extensor origin. That flash that you just saw was me injecting the first bit of platelet-rich plasma, and you'll notice that my nurse captured an image of that on the ultrasound machine while I was injecting. Now you'll see that I spread this injection out through the common extensor origin, and you'll see the bright straight line coming down from the top left of the screen. That's my needle. It's a very straight line. You'll see that moving. That's the needle tip. And that's one final look, and the injection is complete. This patient tolerated this injection extremely well and had minimal discomfort. This can actually be a somewhat uncomfortable injection, and as the platelets go in, they do have a tendency to burn. That's why we've decided to start using lidocaine prior to the injection, which makes the injection significantly more comfortable. A couple of band-aids are placed on the arm, both at the injection site and the numbing site, and the patient's finished. After all tennis elbow injections, we place our patients into a wrist immobilizer splint. This helps protect the common extensor origin, which actually controls extension of your wrist. So it seems counterintuitive that we would splint somebody's wrist after an elbow injection, but slowing down your wrist actually inhibits you from being able to use this particular muscle group attached to this tendon. The splint that you see being applied now was actually warmed in an oven for about 5 minutes prior to application, and the plastic material became soft like neoprene, and we're able to custom mold this right to a patient's wrist. This is excellent for athletes and people who are going to go back to work and need something that is functional and a little more streamlined. That's the end of this video. Hope you enjoyed watching our platelet-rich plasma injection.